right, we'll give people a few minutes to get on here before we get started. Right. All right, about 15 more seconds, you all. We will get started. Okay, so back again, Dr. Mister of Soul and Reap Physical Therapy. Today, you guys, I have on my mentor. Like, I absolutely love her, Miss Katie Wolf. We are going to continue our conversation on Women's History Month. Apologies, Women's History Month, and the term that we are using for this month is empowerment. Okay, she's here to discuss all of the work she's done and been a member of the LGBTQ community. So a little bit about her bio. Katie Wolf served as the Chief Operating Officer at Trans Health Northampton. Katie brings a wide-ranging health management skill set to this work, drawing on experience in a large-scale change management. Working for Massachusetts General Hospital, or MGH, and Partners Healthcare, Katie served as a leader in digital health, IS, informatics, and transgender health for more than 10 years, managing large mission-critical projects in support of clinical operation. Prior to working in Trans Health Northampton, Katie served as a chief of staff within Partners Digital Health, working directly with the Chief Digital Health Officer. Alongside Katie's work in digital health, she has led work in both MGH and Partners, expanding clinical care and expediting organizational change regarding LGBTQ health, specifically transgender health programs. Katie earned her bachelor's degree from UMass Amherst and her MBA from Simmons School of Management. She serves on a wide array of boards and advisory groups focusing on digital health consulting, LGBTQ health, queer competent domestic violence, and healthcare and business education. Outside of work, Katie spends her time baking, making cheese, reading, and spending time with her family, you guys. I am bringing on my mentor, Miss Katie Wolf. Hello.
Hi.
How are you?
I'm so happy to be here with you.
Likewise. This is the second time we've ever seen each other, y'all. We talk on the phone, but to ever see each other. And she's way up in Massachusetts, but has a wealth of knowledge, you guys. And to make this even more special, like I received an email from the APTA section on pelvic health. And this week, from the 22nd to the 26th, is National LGBT Health Awareness Week. So perfect timing for this.
Celebrating all of it.
That's right. That's right. Do you want to start out and tell us a little bit about yourself, your story, anything you want people to know about Katie Wolf and her family?
Sure. Well, I live outside of Boston, Massachusetts, but I work more in Western Massachusetts. I just came back from commuting there. I have a wife and two kids who just turned 8 and 12. I grew up originally on the West Coast outside of Seattle. I'm a country girl. I grew up in a log house that my parents built that was wood heated. I spent a little time in Arizona. The Southeast is the only part of the country I have not lived in.
Okay.
I know. And I do bake and knit and make cheese. I say that I have a master's in the matronly arts.
Okay.
And generally, I've worked in healthcare for a really long time, and I have done, kind of very operational and leadership roles, but also really have been so, I think that for a lot of people, when we get to work with our community, whatever that community and what that means to us, it brings such a deep sense of reward to me. So I've been so fortunate to work within LGBTQ health, either as a part of my role in Mass General and at Partners, or now it's called Mass General Brigham, or now full-time working at Trans Health Northampton, which is just a dream for me.
Yes. Oh my gosh. So excited for you and your team for that project that you all, she was going to tell us more about that in a few. But one of the things that we discussed that members of LGBTQ community have is difficulty with starting a family. Do you mind sharing information on that?
Sure. I mean, I think that there are, like any group that is minoritized, right? We face access to healthcare issues, which is that the people who are often providing us healthcare may not understand who we are, the challenges that we face, what our lives have been like. And it's not even that people have ill intent sometimes they do, but sometimes it's just a lack of awareness. So I think that, throughout my life, When I was growing up, nobody ever talked with me about, I didn't have any role models who were LGBT. I didn't know it was possible to be attracted to other people of the same sex, or that there were other people like me. And so I think that throughout my life, it really has been trying to feel my way out on my own. And something that I think almost all LGBT people have in common is that when you figure out who you are, right, and you tell other people, you really risk everything. You risk rejection. You risk, LGBTQ people face homelessness, being kicked out of their families, being kind of disconnected from their families of origin at incredibly high rates, which means that people have to have less access to education, resources, healthcare, advocacy, people to fall back on. And so I think that they're just, and this is indicative of really all groups that are stratified in different ways. I think that one of the challenges in healthcare is that, for us, when I got married, you'd still go to, and they would say, what's your husband's name? Or you're married. There's an assumption that you're married a man.
Yeah.
And then when my wife and I decided that we wanted to have children, there really weren't resources to tell us how to build a family, right? And so I had straight heterosexual friends who were starting families. But I think that all people who face stigma, who get pregnant differently, people who use in vitro fertilization, people who do intrauterine insemination, people who are single parent by choice, people who are gay men who use surrogates, or families, period, that use surrogates, or trans people who, need to figure out different ways to build families, or people who use adoption. All of these things are really just kind of non-normative experiences that we kind of find ourselves out in the wilderness, often without models within our families to help us progress. And so that means you have to do a lot of information gathering on your own. But furthermore, insurance doesn't necessarily cover those things. So, there wasn't necessarily coverage. We had to figure out, okay, I have insurance, and that's great, but what does insurance cover? And I think that, you have to do so much on your own. And even then, how do I find, for our family, a sperm donor, right? How do I choose a sperm donor? Some people have questions about using, sperm of somebody that they know. What are the risks and benefits of that? How do I navigate that situation? And we didn't really have a lot of people in our life who've gone down that path. And so you find yourself reading books and looking on the internet. And it, in general, the cool thing about it is that there isn't a model. So, you're kind of forging out on your own. You get to do your own thing. It's not like, it's not like the path has been trodden out in front of you. But it also means that I didn't know what an OBGYN or a midwife would say when I would visit them. I didn't know if they could be helpful to me. I didn't know what it was going to be like. And, like when my daughter, and this is another nuance, when my first child was born, when we got the birth certificate, my wife and I were married in Massachusetts, but we didn't have federal marriage equality yet. And so what that meant is that our child was, and a lot of people don't know this, but this is still true in Massachusetts and many states, we had to adopt our own child, right? So that if we traveled outside of Massachusetts at this time where they didn't recognize our marriage, then we had to have adoption. So we actually had to get affidavits that from people saying we were qualified parents, we were reasonably good parents. I had to get a document saying that I did not have extraneous exposure to sperm, right? That this was from a donor. It couldn't possibly be fathered by another person. I had to go through the court system. We had to tie up the court system, seeing us as two parents who, conceived this child together and went and birthed it. And we did that with both of our children. And that's still, like, even though now we have federal marriage equality, if a same-sex couple travels to a place where they don't have marriage equality, they don't recognize our marriage, if we don't have that adoption, should something happen to me and I birthed both of our children, if something happened to me and my child, my wife wouldn't necessarily have the ability to intervene. And so it just is like, there was no guidance for that. And all of that cost money, took time, took energy, and we felt like we were really alone through a lot of it. And when we got that first birth certificate, it actually had father crossed out and had parent two written in there, right? That's on the birth certificate for my child. So it's been, through the whole thing, it's just been a very different experience. And I would say that we've come a long way since, I conceived and had my children. But there's still tremendous disparities. And I would say that those intensify for so many people who are trans and gender diverse, specifically within healthcare. So things have become more normalized. But I still remember this moment where I was at the 6-week postpartum visit. We were with our midwife. I was standing next to my wife with my child. And the midwife said to me, "What are you planning to use for birth control postpartum?" And I was like, lesbianism, like.
But I get it. I get it. Yeah.
Not having sex with a person who makes sperm, right?
Gotcha.
And you just like, the midwife was just going through a checklist, right?
Yeah,
but so many of our checklists are based on, very normative guidelines. And I think those things are really hard for people who have different sexual orientation or gender identities in terms of marching through healthcare.
Gotcha. And that's what I was going to say. Yeah, she was probably just, and it is a habit. And that's my next question for you. Being a healthcare professional, and I do want to support those transgenders, right? I want to support them, especially post-op after they've had from a male to a female, the surgery. So because there can be scar tissue, there can be difficulties with them healing from that. That's a major surgery, and pelvic floor physical therapists, we do a lot of pelvic floor physical therapists help with that. So I guess one of the things that, because personally, this is going to be something that I'm starting to get training on as well. We talked about this too, like, the pronouns. What if I forget? Like, how offensive is it if they're going to be called she, but I'm seeing a he, or, and it can, because again, we are trained in a certain way and we're going through those steps. So how, as a healthcare professional, can we help? What can we do I know communication is key for everything, but if I make a mistake and use the wrong pronoun, is it a big deal?
It's a big deal. And it's also something that I think that you can get back up from. Like, I've had people say to me, "What does your husband do for work?" Right. And for me, I say, "I have a wife." And they, if somebody says, "I'm so sorry I made that assumption. I'll make sure I don't do that again. Thank you for telling me. I'm sorry if I offended you." And we move on. Right. I think that if you mispronounce someone, I think it's really important to acknowledge it and say, "I'm sorry. I'm going to work hard not to make that mistake again," and then move on. Right. You don't say, "I thought this because, you had this trait," and that may be a trait they're very self-conscious about as well. So I just think that in terms of sexual orientation and gender identity, we have a lot of assumptions embedded into us. And I'm even going to admit, once I was talking with this woman and I assumed she was straight and she was married to a woman. And I was like, how did I just assume that? Like, this is my community. And people have made that assumption about me, and it's been hurtful. So I think that there's just like, have cultural humility about it. But I think there's also a lot that we can do to figure out how can we be more affirming providers. And a lot of that just comes down to, like, I think a lot about, I've been reading quite a bit. There's a person I follow on Twitter who I love, Dr. Teresa Chappell, who really does a lot of work on maternal fetal outcomes and specifically looking at Black parents and what they experience. And we know that Black people who deliver with white OBGYNs and pediatricians have much higher rates of death and poor outcome than if they're delivering with a Black OBGYN or midwife. And it's not that I think a lot of white people in that field set out to do harm. It's that they have intrinsic bias and racism kind of imbued in their education, their training, and the culture around them. And so I think that no matter whether you're serving in a predominantly white area, it's the responsibility of white people to learn about that, educate themselves more, and kind of step up. And so that's what I would say around issues of LGBTQ health. I think what is incumbent upon all of us who are cisgender, right? Somebody who's not trans, somebody who, like, when I was born, the doctor said that I was a girl and I am a woman, right? Okay. So that's called cisgender. And so what is incumbent upon me is to say, like, how do people who are more disenfranchised, what are their experiences? And how do I begin to educate myself more? Yeah. And so I think that there have been a lot of exciting things that have been, this is exciting for a nerd. Let me qualify that. In medical records like Epic EHR has been really parsing out, okay, what was somebody's sex assigned at birth? What's on their legal identification? And then how do they identify? And I just think in healthcare, thinking about those three things, like what's on your insurance so that your insurance claim doesn't get rejected, right? What is kind of your genetic background? That may be important for different things, but more importantly, what is your gender and how do I refer to you appropriately, right? Asking those questions when somebody comes through your doors immediately says, I want to know more about you and who you are.
Gotcha.
Asking somebody what their pronouns are, making them prominent in your system so that you kind of check them. So, and even introducing yourself, I didn't even do it at the beginning. My name is Katie Wolf. My pronouns are she, her, right? And starting with that and normalizing that as you kind of walk throughout your day, right? When you're meeting somebody new, using your pronouns. I think that for a lot of people who may present, but as male or female, but use they, them pronouns, or people who may be frequently misgendered, what that does is signals like, hey, I want to know who you are, and I'm going to like hold space for people to not make assumptions and do this. So I think that just in terms of not making assumptions, if you do make a mistake, acknowledge it and take it on your own back. And I have made that mistake as a member of the community myself. Right. And then I think also really doing due diligence to kind of do research in your field. So for trans people who may be, patients of yours, I think thinking about how do I go out, learn more about that and making a normal experience. And for what you don't know, not asking your patients to educate you, but say, I need to do more research. Let me do this and come back. Right. I think that's really important too. I think so many people, clinicians will have asked me, how do I do this or what do I do? Or, I've had, people say, how do lesbians make families? Right. How do queer people make families? And I'm like, why am I telling you? You're a radiology tech. You don't need to know this. Why are we talking about this? Like, I'm glad for your curiosity, but like, this is not the apt moment for it. Can you please just tell me if my, fetus has 10 fingers and 10 toes? So, I do think that, figuring out for somebody who is trans masculine, who may have had a hysterectomy and has pelvic floor weakness after a hysterectomy, and they've had that affirming procedure, how do we continue to make that, an affirming space? And I do think that there is a lot that, we talk about a lot of OBGYN care as women's care, and it really is for people who are non-binary and transmasculine. It's not. It's very connected to their anatomy and physiology, but not connected with being a woman. And so I think kind of depiecing that and really kind of, I think if you can imagine like what it's like for a person who is lesbian, gay, bisexual, trans, gender diverse, non-binary to walk through your practice, right? And think about what that is. I think that you can immediately I think everyone who's been kind of raised up in traditional healthcare can see a lot of things that need to change.
Right. And so you said a lot of terms that a lot of us, okay, like cisgender, non-binary. Okay, can you explain? I know you told me the best tool you have is Google, and I agree. You're so right. But sometimes, myself included, we get lazy, right? And it's like, can you tell us, give me a starting point, and then we can take over from there. So you want to explain briefly some of the terms that are commonly used in LGBTQ community?
So I think that, very common terms for us, lesbian, to women who are attracted to other women. Gay is used ubiquitously, but very similarly, men who are attracted to men. Bisexual, which is people who are attracted to both men and women. I think a newer term, and this is kind of the thing that I love about the LGBTQ community, is that it's ever evolving. The terms, like some people get overwhelmed by that. I think that one of the things that I would invite people to explore is the idea that that's kind of cool. Like gender continues to mean something different over time. Sexuality and sexual orientations begin to mean different things over time. And I think that if we can meet them with curiosity and openness, it actually is kind of a fun adventure that we all go on, and I learned something new about myself. So, bisexuality used to mean like, hey, I'm attracted to both genders. But I think as we've kind of come to expand gender and include, non-binary people have very wide gender expressions. People can look stereotypically masculine or feminine, but not feel particularly like they're in one camp. They may be people who kind of present androgynously or not, but generally non-binary people use different pronouns, perhaps they,
Okay.
them pronouns, or, frankly, there are z, zer, zer.
Yeah.
People use it, like there are lots of different pronouns that people use to identify themselves.
Right.
There are people who don't actually really like pronouns. They just like their names. Just refer to me as this.
Okay.
Um, and then pansexual, which is something that's come up as a kind of an expansion of bisexuality, which is somebody's like, I'm attracted to all genders, right?
Okay.
And queer is also one of those terms that our community has reclaimed, which is kind of like queer just means broadly a part of the umbrella, right?
Okay.
So I think that as genders evolve, bisexuality has kind of become more pan or queer, right? Broader terms.
Gotcha.
And then there are trans and gender diverse. So let's start with cis. And cis basically is like, when I was born, Harlan Giles, the OBGYN who delivered me, said it's a girl.
Okay.
And as I grew up, I felt like a girl, and that is who I am. I grew up to be a woman. I think for trans folks, if somebody says it's a boy or it's a girl, and as they grow up, their gender that they feel within themselves is not what they were assigned at birth. Right? They identify as non-binary or female. And so typical terms are AFAB, assigned female at birth, assigned male at birth, right? But they identify. So I think like just asking somebody what their gender is, right? Or I think, there are a lot of really respectful ways. Can you tell me a little bit more about your gender if you're comfortable? I would like to make sure that I respectfully talk with you about that. Right. I think these are really important things. What are the pronouns you use so I can make sure that I'm respectful and understanding in the way that I address you? Right. I think that as long as you come at it from a place of curiosity and respect, there's a lot of traction to be gained in gaining trust and really building trust with patients and with colleagues.
Makes
And
sense.
friends.
Yep. All right. Thank you for that. Yes. And so you are a wealth of knowledge. And so what are some resource sources for those who they don't know where to turn? They're a member of that community, there's questioning if they're a member of that community, and they're like you said, when you were coming up, you didn't have the resources, but now you said, there's a lot of resources out there, right? And so you mind sharing some of that, and that especially the ones that are nationwide that anyone in any state have access to,
So I think that, there's, so first of all, it's a quick Google search away. I think some really trusted things. The LGBTQ National Help Center is available to people. The Trans Lifeline is an organization far and wide that people can call and make sure that they have resources there specifically if they are depressed, alone, need resources, guidance, and help. There are other organizations that are regional, but by and large, if you kind of contact the national organizations, they can help you find local chapters. I think one of the most resource groups across the country is PFLAG, which is Parents and Friends of Gays and Lesbians. And that group is generally parents and friends of people within the LGBTQ community. And I think that's such an important resource for folks who are just trying to figure out how to become wonderful allies to people within the community and learn more. I think it's also such an amazing thing for kids who are coming out as their parents are trying to learn, right? To not put the burden of learning on the children, but to reach out to resources in their community and also process their emotions and not do that with their kid. If they're feeling like really, if they're struggling with this, finding community of people who've gone through it and leaning on them. I think that there's also the Trevor Project, which is a great organization for people to reach out to. Specifically, it's for LGBT youth who may be really needing help as they are coming out and figuring out who they are. So within that, and then clinically, I think that there are more organizations that are out there to really kind of help clinicians learn more. There's UCSF, University of California, San Francisco, has a lot of resources around LGBTQ health and standards of care. WPATH is another one. And then there's GLMA, the Gay and Lesbian Medical Association, that's a narrow name for a broad group. But I really think those are organizations that you can look at to get more resources as clinicians. And then I would say within almost every professional organization that's at a national level, there are LGBTQ task force that work within them. And so I think that, it's just so important to have people reach across different groups and get involved and say, like, I may not be of your community, but I want to be a resource. I want any patient that comes through my door to feel safe, cared for, and supported in my space. And how do I take proactive steps to ensure that people do that when they seek care with me?
Exactly. And that was one of the reasons, because I mean, you opened up my eyes to that, because when I was brainstorming with you my business idea, you were like, have you ever thought about treating transgender patients? And I was like, no, but thank you for that, because now you put that spark in, and now I've just been researching, like, okay, yeah, that is something, because like you said, they don't know where to go. They don't know where to turn. They're trying to figure it out on their own. They're healing incorrectly, which may lead to more surgery, especially those who had the transgender surgery. So it's just like, it was like, I hear you, Katie. Like I took that and I was like, definitely, I feel like I can help. So suicide prevention, that was another thing we discussed, and how.
I think that, and this is just true of any minoritized group, when you kind of face discrimination and you're not, you may have strained relationships with your family, you may be underemployed, you may be facing discrimination in your housing, you may be kicked out of your church or, religious community. I think that all of that increases suicidality and depression. And so LGBT folks have really experienced depression and anxiety at staggeringly high rates. Mm-hmm. And so I think that, Trans Lifeline and the Trevor Project are just two organizations that are wonderful resources for people who are really struggling with depression, suicidality, and generally need support. And even if you're kind of just feeling stressed and you don't know where to turn, those are great resources for you to call and say, I'm struggling, how can I get some help? But I think that, we all have a responsibility to figure out, how do we keep reaching out to groups that we know are under stress, and making sure that the spaces that we provide for them can be a safer space for people to come, and in a space where people feel affirmed and cared for, and a respite from the outside world, perhaps.
Yeah, that makes sense. Okay, so you guys, she is doing this amazing thing where they just opened a clinic called, and that's this website, www.
It's not open. It's not open yet. We're just starting.
Oh, okay. Well, it's here. It's like, it's almost in, right? But it's almost, for trans, right? For transgenders. You guys, I'll let you explain it. It's amazing. Yeah.
So the terms that we use are transgender and gender diverse individuals. And so, I think that what we found is there's a tremendous amount of discrimination in healthcare, and there are wonderful people doing wonderful things, but not nearly enough of them. And so I am working a place called Trans Health, which is located in Western Massachusetts. It is not quite federally designated as rural, but it is a more rural area, right? Okay. So it really is trying to serve trans and gender diverse people in Western Massachusetts and their families, and be a resource to people within the community. There are wonderful resources in Western Massachusetts, but we're really trying to add more of those to the community, and really trying to serve what has traditionally been a community that has not received the care that it needs or deserves from the medical community. It will be providing adult and pediatric primary care, as well as behavioral health services for people within the community and their family members.
Awesome. So, but I guess, can I ask you if you guys have a projected opening date yet, or still?
We're looking for the spring. And as you know, it really is about when licenses and credentialing and other things come through. But we're excited to, we don't want to tell people, so they call us and we say, we can't see you yet, but we're working hard to get those things in order so we can see patients as soon as possible. And we're so excited. We've really been building a great staff of people who've just spent a lot of time learning about trans and gender diverse care. Our entire staff is LGBTQ plus, and we are just so excited for what is to come, and not only just being a resource to our patients and their families, but also making sure that we are a resource center for people. If you go to our website, we will have and will continue to add to resources for the community, so people can learn more. And so we are excited to not only provide care, but really be a place where people can learn more from, as clinicians, as parents, as community members, as LGBTQ community members, and the whole gamut.
Gotcha. And I will definitely be checking that site out, because the information you've sent me so far, I'm like, okay, yeah, I can definitely use that from a clinical standpoint. So you also made it known to me today that the 31st of this month is Trans Day of Visibility. So is it just like, what are they celebrating on that date exactly?
Well, I have to tell you, I don't have a long history with it, even though I've worked within LGBTQ health a long time. So I think that, I'll be honest, we have like Pride Month, which is great. It's a big celebration in June. And then we have the Trans Day of Remembrance. So we know that trans folks and gender diverse folks are facing an unprecedented amount of violence. So there have been so many trans women specifically who've been killed who are predominantly Black and Latinx. It's an entirely, it is probably the most discriminated against group. And, trans women of color specifically face an outrageously high level of violence. And so the Trans Day of Remembrance is in the fall. And it's when we take moments of silence and really recognize the vulnerability of this community and the threats to, people who've often just been treated not well. But I think of Trans Day of Visibility as a day for us to celebrate all the gifts that the trans and gender diverse community bring to us, and a day to really celebrate people within the community. We are so excited that Dr. Levine was just confirmed by the Senate to a national post within the Biden-Harris administration. So we are beginning to see more and more trans folks who are ascending to national posts. That is so exciting and such a reason to celebrate. We're seeing more and more LGBTQ folks in general, I think, becoming more known, prominent, celebrated, hired, and recognized. Not nearly enough, within the community. So what I would just like to do is continue to raise up and celebrate people who are trans on March 31st. Use that as an opportunity to do a little bit of digging and history and say, who are our trans ancestors and what have they lent to our community? Just like we do during all of Black History Month, Women's History Month, using it as an opportunity. Like one of my favorite things to do is whatever History Month it is, I get a book and my kids and I read at night and learn more about it. So it's a wonderful opportunity for us to stop and take pause and learn more about people within our community and other communities we don't have as much familiarity with.
That's true. That is so true. Well, guys, Katie and Lester, is anything that you want to say that we did not cover? Is there anything else, or I think we covered it all? Like,
there's always more to cover, but Latanya, you are one of my favorite people with whom to speak, and I'm just so happy to be here and so proud of everything that you're building at Sew and Reap.
Yeah, you guys, she was there when it was just a thought in my head. She was there, was like, okay, write this down, right? So, thank you, Katie. I know I tell you that all the time, but the little encouraging words that you give me, allow me to vent about business. I thank you for your listening ear and for your mentorship. You are amazing. And I met her, guys, through ACP, which is another great, they provide you with a mentor. And as you see, Katie, she's amazing. And we decided to keep in touch. Usually it only lasts a year, but for us, it's well over 2 now, right? Like it's, about 2 years
I think we're just friends now. We just say that we're friends now.
So true.
And, and through that, to come full circle, as we've started our practice now, you can lend me advice because you've come before me, right? So I left a big organization and now I'm working with a wonderful team to build something new. And so you've been through, you've paved the path now that I get to learn from.
Thank you, Katie. And I'm still paving and I'm still learning. As you know, in business, every day is a day of learning. So thank you again for everything, for your listening ear, for the resources you just provided to everyone. You guys, Katie, her information is on that her website as well, www.transhealth.org. You can go on there and reach out to her if you have any questions or anything that you want to ask her. So thank you again for your time. You guys, she's a super busy woman. They're starting a new clinic. Super excited. I can't wait to hear the opening date and celebrate with you. So until next time, y'all, take care and good night. Bye-bye.
Thank you.